Okay, you're recording? I'm Dr. Jones. I'm addressing your CDC group about the meningitis B outbreak originating from Camp Overlook. Meningitis B has been reported in a group of high school seniors from New England. The students were part of Serve Appalachia, a civic group volunteering in a poor part of West Virginia. Men-B is spread through exposure to salivary secretions, usually through close or prolonged contact. Once you're infected, the protective covering of the brain and spinal cord swells intensely, resulting in headaches, severe fever, light sensitivity, limb loss, even death. The only way to really prevent an outbreak is vaccination, and supplies were already limited, causing scarcity. It'll be months before we have access to a new supply. And we know that other groups at risk were at the camp. You're talking to those other groups too, right?
Staff Sergeant Shaw. These are the folks from the CDC, and they would like an update on the situation.
We had soldiers stay at Camp Overlook while providing aid to the victims of a devastating tornado. Our bases had to go on lockdown due to the threat of the bacteria spreading. If the situation gets worse, there could be a global pandemic. This outbreak has to stop on our bases here and now. The president is asking to get the vaccine for military personnel. This is a matter of national security. If you'll excuse me.
I'm Dr. Lee. We had some of our volunteer doctors based at Camp Overlook treating poverty-stricken patients who don't have access to good medical care. Unfortunately, the doctors weren't symptomatic until they were in Kentucky at a conference for the American Medical Association. We need to get these doctors vaccinated before they travel to other places in need. They're the first responders. They're the ones that have to go where the outbreak happens. They're the ones that need this vaccine most.
We had a group stay at the camp to research the environmental effects on the health of poor people in rural Appalachia. Now, most of the team got vaccinated, except for 2 members who are passionate about alternative medicine. Both of them got sick, and they're extremely ill back home in Atlanta now. Our team sees the epic nature of this crisis and has offered the CDC 10 times the cost of the current vaccine supply, thanks to one of our financial supporters. You see, the CDC can work with the pharmaceutical company to make more vaccine. And we plan to inoculate our colleagues who are working around the world on this research and are often living with people who need help. And we plan to give the rest to the staff at Camp Overlook.
I'm Mayor Thomas from Baltimore. Some of our inner city kids from Camp Overlook came home sick. They're currently in the critical care unit at University of Maryland Medical Center. Thanks. Our food banks and homeless shelters have closed down. People are afraid to go to them because they're afraid of getting Men-B. While it seems hospitals in more wealthy areas are deemed priority, we need to inoculate everyone, especially the more at-risk citizens, and prevent this from spreading further. Baltimore, our kids need this vaccine.
It's all well and good that everybody wants to save their kids in their cities, but our kids here in New Hampshire got sick on that service trip. Their brothers and sisters, kids at school, everybody's getting sick.
I'm a parent. I'm also part of the American Academy of Pediatrics. We have got to vaccinate our children. Any of these kids who came in contact with the infected high schoolers, babies, toddlers, all of them. I know the current CDC recommendations don't recommend vaccinating children under the age of 10 for Men-B, but these kids are seriously ill. We have to start with the children.
Now, your CDC team has to make a decision. Which 2 groups get the vaccine?